My name is Andrew Shubov. I'm the director of the Inpatient Integrative Medicine Service at UCLA Santa Monica Hospital. I'm a member of the UCLA Center for EastWest Medicine, which is a series of 4 clinics around Los Angeles, kind of more on the west side. I did go to USC for medical school, and I think that's why they call it East-West Medicine, is that we do cross the divide. But I'd like to share with you I'd like to try to make something very complicated, very simple. And I apologize about the strange title. This Complex Systems for Complex Problems is a way to understand how acupuncture and Chinese medicine approaches medicine, and in a way that should be pretty straightforward. Chinese medicine is a very archaic sounding system. It involves 5 elements, yin yang, a lot of concepts that are really foreign, but they don't have to be. And if we don't use those terms and we use terms that we are familiar with, it can actually be very straightforward. And I'd like you all to come away with this, from this lecture, with an understanding of how acupuncture actually works. And not only that, but an actual evidence-based approach or evidence-based appreciation for all of the work that's been done in the last 50 years about how acupuncture works, and also why we don't really have a good answer for how acupuncture works. And the rubric that we're going to use today is this idea of a complicated system and comparing it with a complex system. A complicated system is really epitomized in the 20th century thought of machinery and complicated systems that can be extremely extravagant. Here's a Switch watch, which I think is one of the most impressive examples of this, but really even most modern computer programming are complicated in that they can do a lot of different things so long as each component works with the component before and the component after. So as long as every gear is perfectly aligned with the gear before and after it, everything works smoothly. And if you remove any small part of it, or if you're coding and one small part of it doesn't fit right, the whole system fails. This is an overwhelmingly helpful way to look at the world. It's led to most of the modern technology that we see around us: cars, planes, spaceships, computers, all sorts of things. But it feels like this is kind of coming to its limits, and we'll talk a little bit about this, because as it comes to modern medicine, looking at, if you're trying to understand how the human body works, it's a little bit like reverse engineering alien technology. And like reverse engineering alien technology, you basically use what's in your head to try to understand what's happening. So if you had a spaceship or a UFO land in your backyard and you wanted to see how it works, you would probably use everything that you know about physics and biochemistry and systems, everything you could think of. And the founders of modern medicine in the 1880s to 1920s or so were really steeped in this complicated systems theory, this thinking approach, this mechanical type of thinking that brought to us cars and planes in around the same time period. And so if you look at the textbooks of cardiology, for example, it looks like a pump system that uses Bernoulli's principle. And this can be extremely helpful, and has been extremely helpful, not only in helping understand the physiology and the mechanics of how the cardiovascular system works, but as we got more advanced with molecular biology, we would develop drugs that would help change the specific, the tension along the arteries and the veins, that would change the pressure dynamics, and then eventually, even more recently, mechanical heart devices that can improve this. If looking further, another part of modern medicine came out of biochemistry, molecular biology, and these things also had this complicated systems approach of the kind of a machine. And for some reason, many of us know this citric acid or Krebs cycle, whether or not we really use it. It was this idea that of how sugar and how the body gets energy, how the cells get energy, and this helps us understand things mechanistically, and has led to lots of advances in terms of vitamin supplementation, nutrients, understanding syndromic problems, understanding how cellular systems function. And similarly, on the right, we have a synaptic membrane, which is how the brain works, and how at least one part of the brain works. And this also leads us to chemicals that serotonin reuptake inhibitors, all sorts of drugs that interfere on this in order to have a desired effect. Unfortunately, the natural world is not really so mechanistic, and it's come so far. We've done a lot with this systems approach, this mechanistic systems approach. But if you look at an ecosystem, you remove one part of it, the whole system doesn't collapse. You could argue that if you remove one part of it, the system does collapse. And I would argue that it's not really collapsing, it's just changing in unforeseen ways. But it's not like the whole system breaks. If you remove the shark, you just have an overflourishing of other fish and things like that. And eventually the system may look completely different than you expect, but it does not shut down and break. If you cut the leg off of a person, they don't shut down and break in the same way that if you take the tire off of a car, it does. So you can almost look at medical textbooks these days as a primer on all these diseases that don't really exist anymore. And this was really frustrating to me and a lot of my contemporaries. And to be a doctor, it's really, really challenging because everything that we know how to cure has been cured already. So we learned about tuberculosis, pneumonia, gangrene, heart attacks even. People, of course, still have heart attacks, but they die less often from them. Peptic ulcer disease, nutritional deficiencies like rickets and scurvy, these are all gone. Cancer, of course, is always there. Although it's different. I mean, acute lymphoma, acute leukemia, some of these things have gone away. But they've been replaced by more complex systems that are not necessarily single problems. In an infectious disease situation, you have a single part that is failing and that is broken, and you need a single solution, like an antibiotic, to fix it. Instead, what we are now, as modern clinicians, dealt with, and as modern patients, what we deal with is these diseases that really are not in the medical textbooks. And with the exception of some of these like congestive heart failure, overactive bladder, chronic cancers, but things like fibromyalgia, migraines, it's easy enough to almost believe that they don't exist if you look at our textbooks and how we think of the human body as working. But it's almost like they're increasing and they're getting more and more frustrating to deal with. As we remove all of the things that we're good at treating from the patient population, so as we remove everything we know how to fix, we end up accumulating all of the things that we don't know how to fix. And so this is a major source of burnout for doctors. And this is what led me personally to exploring integrative medicine. I would say this is the 21st century disease category. What happens if you try to take a complex disease like fibromyalgia, or this is an example, this is a paper that was published in 2007 about how obesity happens. And we take a complicated systems mechanistic approach towards how obesity happens. In the center, you have energy balance, and you'll see that you have your individual psychology up on the top, your individual physical activity, your individual physiology down below, your food consumption, but that each of these is really tied to the area that you're around. Your food consumption is related to the food production. Your individual psychology is related to the psychology of those around you. Your individual physical activity is related to your physical environment. And really, we can define every step along this process, but it is nowhere near as helpful to us as, say, saying that tuberculosis is caused by mycobacterium, and that will respond to these antibiotics or antifungals. In a sense, I would say that these complex diseases fail to respond to these complicated systems interventions. For example, you tell somebody to eat less, it doesn't really work. So enter an approach, the Eastern approach, Eastern medicine. What we're going to focus on, basically what I'd like to suggest to you is that ancient systems of medicine, even though they come from an archaic, relatively alien, foreign appearing surface, actually are better suited at some of these diseases. And one of the ways to describe the difference is that instead of looking at the body as a machine where each part is dependent on the other, you look at the body as a garden, and your role is not a mechanic to replace a part. Your role as a doctor would be to nourish it. And if a plant is not fruiting, you don't spray it with chemicals necessarily. You might look at the soil and drain it or moist it, cultivate it. So specific ways of thinking about it, it's helpful to have specific examples of this. And one example is this idea of resilience. Resilience we've talked about, actually this morning we talked about resilience. There's this term in Chinese medicine called defensive qi, which to use these terms doesn't really help us. Let's just use these terms called resilience. And so what happens when you take somebody who's, let's look at what happens when you have a very resilient person. One of the best examples of a resilient person, I would say, would be The Rock. He, you'd think, is not easy to knock down, but he's also probably not easy to make sick. And probably if you put him in a cold environment, he probably would not get too cold too quickly. He can probably hang out there a little bit longer than the rest of us. How does he do this? Well, involuntarily, and in some circles, you might say that he manifests an aura of defensive energy around him to protect him against the outside elements. In Western medicine, we would say that there's a thermodynamic barrier of heat that is transferred from his skin to the air around him. And simultaneously, he shunts his blood to the inside to keep his temperature warm inside. In Chinese medicine, we use the term defensive qi, that there is an aura, just to use this construct of an actual kind of a defensive layer around you. And you can cultivate that. And if you compare it with other people, say a normal person, or like somebody like me, we also would do that. We just may not do it so effectively. Our aura would be a little bit less robust, we can say. And if you put this with somebody on the older age of the spectrum, something similar happens, but just not quite so well. And intuitively, we all know this. But the strange thing is, there's nothing in the medical textbooks, no test, no MRI, CT scan, no temperature probe. Like, you can't really, before you put somebody in a cold environment, there's really no way to measure. There's no lab test. There's no way to measure how strong their response is going to be to the cold until you put them in the cold, except that intuitively, we all know this. We don't have to have any training to understand this. Chinese medicine actually has some very clear physical exam findings, history taking. There's things that we can ask them. There's things about their diet that are helpful to determining this beforehand. Of course, it's not that helpful to know how people react in the cold, but the same thing applies in a septic environment where it's dirty. You have a lot of bacteria. There are people that will succumb to illness faster than others. And generally, this is a marker of their, what we would call in Chinese medicine, defensive qi. Incidentally, in Chinese medicine, the strength of their defensive qi is measured by the temperature, their fever. So a kid, for example, has a very strong defensive qi. They have a high temperature of 105, 106. They can get seizures. Older people have a very low temperature rise when they get sick. And actually, when they get sick, they may have a drop in temperature, which is all generally a bad thing. The lower the temperature rise, we generally know is a bad situation. We've known this for a long time, and almost, back before modern medicine, we've known that certain diseases affect people that have malnutrition more than others. Tuberculosis used to be called consumption, and it was felt to be a disease of socioeconomic problems. It was more of a nutritional and socioeconomic disease that affected those on the poorer end of the spectrum. And those that walked among the tuberculosis wards, the doctors, the priests, were somehow surrounded by this safety that they do not get consumption in the same way. This is, I gave this talk a year ago. It did not have the same kind of potency to it right now. Right now, the whole world is excited about what we can do to raise our defensive qi, because the viral, antibiotics, infectious disease never really needed help from Chinese medicine. But the first Chinese medicine textbooks on infectious disease, especially cold illnesses, was written in 200 AD. And it's astounding how advanced as modern medicine has become. All of our, the most effective thing we can do against COVID or any other SARS, any other viral illness, is really to reduce virality, socially distance, wear a mask, these kinds of things. And we know kind of more in the lay media, these other ideas of adequate rest, adequate nutrition, vitamin D, zinc, specific foods, herbs are still not really talked about for some reason. Now, China is actually using some of these ancient formulas very widely, and in combination with UCSD and UC Irvine, I'm very proud to be part of a large research study that's going to be studying Chinese herbs on COVID. So hopefully you may be hearing about this in the next few months, but it's just an interesting, fault of our medical system that we still don't really have a grasp on how we can support the host and increase host immunity. Let's switch gears, because infectious disease is not really where I want to go with this. The 21st century diseases, fibromyalgia, migraines, all of these things, that's more where we need the help, I think. I mean, hopefully, knock on wood, infectious disease is not going to be where we're going to need the help for a lot longer. So as a thought experiment, so let's use this, this morning we had some guided meditations about to bring some sense of peace. And I'd like to try to, if you could follow me through this, let's close our eyes and just get us, let's slow down to the point where we can feel what some of these emotions feel like. Typically, you associate meditation with calming and relaxation, but what I'd like you to do is to feel infuriated, just furious. Just imagine the last time that somebody said something that was just overwhelmingly frustrating. These days, all you have to do is tune into the media. Often you'll find a figure that that you may be your favorite person to love to hate, for example. Could be anybody. I'm not thinking of anybody in particular, but just imagine when the last time somebody said something that was just infuriating. What does that feel like physically? And usually I give this talk in front of people. I can, have some audience participation. So I'm going to instead put some words in your mind. But physically, when I feel frustrated, I feel a tension up here. I feel a little bit of tension in my neck. Everything kind of tenses up a little bit. Sometimes I kind of feel a little bit of blood pressure rising, just like a tension in my neck, a little bit of a fullness in my head. Some people will say that they cramp up a little bit in their stomach, or maybe they get a little reflux or sour stomach. Or sometimes they have to urinate, they have to go to the bathroom, just kind of feeling of tension. In Chinese medicine, we use the term stagnation. Stagnation is, it's a very English word, but it actually, the Chinese medicine term is very much the same. Imagine a reed that's blowing in the wind, that's moving without any impedance, and everything's moving beautifully. And imagine your human body as that, as the blood pumps to your fingertips and everything moves gently and easy. And the exact opposite of that is stagnation. You get so infuriated and tense, and your blood doesn't really move to your periphery. It doesn't really go to your hands. Your hands get clammy, and your chest gets hot because there's no temperature change. And you may kind of get a palpitation or some kind of like tension here. May get red in the face. These kinds of things. We call it stagnation. And the easy way to relate this to medical problems is to say that, to imagine how if you're stagnant for long enough, it leads to muscle spasms. The muscles themselves will tense up and spasm. What does that mean systems-wise is the musculoskeletal system is easy to understand. Your muscles tense up. Your neck tenses up. Your neurologic system also tenses up, meaning that let's say the blood vessels in your head might spasm up. You can get a little bit of a headache there. Your blood vessels spasm up all over the body, so your blood pressure rises. So if you squeeze on your blood vessels, your blood pressure rises. Also, maybe even your heart itself might skip a beat, so it kind of, twitches a little bit, gets an extra beat. All sorts of gastrointestinal problems can happen. Your stomach is a muscle that can spasm up, which will cause reflux of stomach contents. Your intestines can spasm up, so that'll cause irritable bowel syndrome or other pain, cramping in your abdomen. Your colon can stop moving forward correctly, so you can have a constipation. Uteruses can spasm, so if they're not peristalsing, if they're not having their natural flow downward, they can kind of stagnate and spasm. That can cause intense cramping. And your bladder can also spasm. A bladder spasm we think of as overactive bladder, so urinary urgency, the overwhelming need to urinate. Um, uh, these things are all pretty natural. They're all actually very natural responses to fear, to stagnation, to anger, to some kind of a threat. So physical, it's usually a physical threat. But you empty your stomach, you empty your urine, you get your muscles ready for a fight, your blood pressure rises, your heart rate rises. All of these things are natural responses to threat. Now, typically we get frustrated. We watch the news, whatever frustrates us, somebody yells at us, whatever frustrates us, we go home, we turn to the next thing, we have a wonderful experience that's rich and deep, and maybe we go to sleep without really thinking too much of it. We wake up the next day ready to get frustrated all over again. But what happens if you are frustrated in a situation where you can't escape it? So you are frustrated, your boss yells at you every day about something that you love to do, that you really want to do, and they're not letting you do this. You come home and your spouse is really mad all the time and takes it out on you. You check your mail and there's another letter from the lawyer about some protracted legal battle. Say your landlord is trying to get money out of you, or divorce, or some other kind of lawsuit, or something just protracted and painful. Plus you're a caregiver for someone you love who really needs your help all the time, and there's no break over years. Well, what happens for your muscles? All your muscles are tense for years and years and years. I've heard a lot of explanations for what fibromyalgia may be, but nothing makes more sense to me than all of your muscles being tense and tense and tense and tense and never letting go for a decade. It causes them to no longer be muscles. They're just inflamed tendons of pain all the time without the ability to let go anymore. A little bit of headache turns into chronic migraine headaches, maybe chronic daily headaches, maybe everything causes a headache. Cardiovascular disease can result, hypertension may become a chronic problem, palpitations, all sorts of functional GI disorders can happen, and we'll talk a little bit more about those later. Gynecologic issues of a little bit of menstrual cramping can turn into actual painful dysmenorrhea. In Chinese medicine, fibroids come out of this. Endometriosis also actually is very clearly understood in Chinese medicine in these terms. If you can imagine a uterus that's not pushing down, naturally it stagnates and actually refluxes up the uterine contents up through the fallopian tubes into the abdomen. You have endometriosis. The genital urinary overactive bladder, chronic pelvic pain, interstitial cystitis, these are all other spasms and chronic tension effects of this chronic stagnation. Now, what happens when you go to a doctor with these medical problems? Well, what we have been taught to do is compartmentalize it into each individual discipline. You go to a rheumatologist for fibromyalgia, a neurologist for your migraines, a cardiologist for your hypertension, a gastroenterologist, et cetera, and each of them gives you a new medication. And we don't really get a sense of that these are all the same thing. These may be the same disease manifesting in different ways, because I mean, truth be told, I see a lot of patients that have all of these diseases and they're on one medication for everything. They're on Cymbalta for fibromyalgia, Topamax for migraines. They're on all sorts of antihypertensives. They're on Linzess and all sorts of supplements for their GI disorders. They may be also going down the small bowel the intestinal overgrowth pathway, the anti-Candida diet. They may be doing all of these really strict things, but then they're also separately trying to figure out what the right diet is for endometriosis and dysmenorrhea, and separately trying to figure out what kind of cranberry extract for the overactive bladder and oxybutynin. And they're never really getting to the root. And so it's frustrating. It's frustrating as doctors because all we have is all these medications, and none of the patients ever come back with Cymbalta and Topamax and all these other things and say, "Thanks, doc, I'm feeling great now. I'm all better." Maybe sometimes it does take the edge off, for sure. I mean, maybe a third or half of people will get some benefit, and but not cure. Of course, doctors don't recommend medications, or shouldn't recommend medications at first. They recommend for all of these the same tools. You recommend regular exercise, mindfulness, sleep, equanimity. Equanimity, Deepak talked about equanimity. There's not enough to be said about it. It's basically the opposite of catastrophization. This too shall pass, kind of a mindset. Psychotherapy, cognitive behavioral therapy, these are all really well understood as the treatments. It's just difficult. It's difficult for the doctor to tell this to the patient. It's even harder for the patient to hear this and implement this to actually do this. So instead, we tend to look for things that we can do to people as doctors. We need to administer an intervention. As a patient, you want to get treatment. You want to get better somehow. This is the context where we think about acupuncture. So let's spend some time talking about how acupuncture works. We'll talk about the mechanisms and also about why we don't understand it and why it's been 50 years of research on this and we still don't get it. Similar to reverse engineering cardiology, reverse engineering acupuncture is just as hard as reverse engineering alien technology. I mean, it's not technically alien, it's human developed, but it's something that doesn't make any sense based on the way that we understand the human body. So similarly, we use what we understand as the most contemporary understanding of the human body at the time to understand how acupuncture works. And so as I go about this, you'll see that how our contemporary understanding of medicine has actually been reflected in this. Case in point, the first understanding of how acupuncture worked was called gate control theory by a man named Melzack, who, without going too far into the details here, there's two types of fibers. There's the small fibers, which are the there's sharp stabbing pain and there's dull aching pain. Sharp stabbing pain is obvious. Dull aching pain is kind of where you have a dull kind of cramping, not really sure what that is. Acupuncture tends to elicit the dull aching types of pain. Both of those types of pain will cause pain by stimulating this pain receptor here. But the dull aching pain also stimulates this inhibitory cell, which is called the gate cell, and it makes it so that you cannot feel the sharp stabbing pain. So if the dull aching pain is being felt, there is no sharp stabbing pain. So if you have a sharp pain in your finger and you do acupuncture right before it, you don't really feel the sharp pain, you just feel the dull pain, which may be substantial. This led to a lot of advances in medical science. TENS units came out of this line of research, trying to figure out how acupuncture works, led to the development of non-acupuncture stimulation to stimulate this gate cell. So TENS units stimulate this dull aching pain and replaces the sharp pain with a buzzing sensation. And many people will forget that spinal cord stimulators, which are considered extremely technologically advanced, came out of this same basic understanding of gate control theory to try to change the sharp pain into a dull, aching, buzzing sensation. Moving on into the 70s and 80s, molecular biology became predominant as the way to understand how the body works. Molecular biology, intracellular signaling, things like endorphins and neurotransmitters became very well understood. Over here is the most adorable picture of acupuncture research that I could find, that all of these acupuncture points are very well mapped onto the animals. So, excuse me, that's not what you think it is. What you would do to study this is you do something brutal and unfortunate to a rat that causes a lot of pain, and then you do acupuncture before it. So say in the forearm. And you find that the acupuncture reduces the amount of pain as measured by something like they put a pressure plate on their hand, on a crushed hand, something like that. You then give them naltrexone or something that blocks endorphins, and you find out that the acupuncture effect is blunted. Case in point, you will now know that acupuncture releases endorphins. Because if it didn't, then that naltrexone would have no effect. This is great. And we understood now acupuncture not only has this gate control theory effect, but it also has this endorphin effect. The problem is you can keep going with other things. So you can talk about, you can release serotonin. You can put serotonin antagonists to block the serotonin effect. You can block cannabinoids. You also partially block the effects of acupuncture. And you can block all sorts of things, and you partially block the effects of acupuncture, which means it's much more complicated. And you end up with tables that just are completely overwhelming and totally useless. There'll be a whole line of peripheral neurotransmitter signaling cascades that we know are involved in acupuncture signaling. And to put all of this into a complicated system Like it works mechanistically well enough to think that it's just endorphins, but when we add all of these other things, it just blurs the picture, and you're left with this cloud of uncertainty, and you know, maybe this whole thing is being made up. Interestingly, if you were to study other complex interventions, like the things we talked about, exercise, sleep, it would probably also be just as complex. It would change all of these. But for some reason, when it comes to acupuncture, most clinicians, most doctors, most scientists that look at this say, ah, well, it's all, you know, made up. Moving on into the 90s and 2000s, the predominant way to explain unexplained phenomenon involved functional MRI imaging of the brain. In 2012, there was a meta-analysis that collated all of the functional MRI studies to that date, which was almost 800. And you can see a graph here on the right, showing just how many studies there have been. And they ended up with this meta-analysis diagram that's definitely my favorite picture in all of acupuncture research. That one of these that the ancient acupuncture masters would just roll in their graves about this. This is what happens to the brain as a representative sample of each of these acupuncture points. And what I'll share with you on the top right, you have LR3, which is short for liver 3, which is on the foot between the first and second toe. So if this is your foot, it's right here. Liver 2, which is just to the left of it, is right over here, just about an inch further away. You'll notice that liver 3 does all sorts of things and liver 2 does not do all sorts of things. It's maybe specific to the area, but liver 3 really lights up the whole brain. I mean, effectively just parts of everything. And if you hear an acupuncturist talk about what acupuncture points do, it's easy to roll your eyes and say, well, there's no possible way that this acupuncture point helps me with sleep and stress and frustration and with my oral pain, and also my digestion is better, and also with menstrual cramps and any liver problems and headache. It just doesn't make any sense that that one point would do that unless you look at this, the kind of effects that that has inside the brain. But more importantly, these are internal controls. So liver 2 and liver 3 are on the same nerve. They're innervated by the same nerve, meaning that the endorphins are the same, that a gate control theory is the same. The endorphins are the same. It's right next to each other. The dermatome is the same. The spinal cord, anything in the spinal cord is the same. But the brain part is different. So in addition to all these other things that we just talked about, there's a specific location that seems to trigger something. And similarly over here, pericardium 6, which is PC6, is right next to PC7. PC6 is right here. PC7 is right here. And it's right along the same nerve in the same area, and it just lights up this whole part of the brain. And you'll notice that you can see how most acupuncturists will use these 5 points. This one, spleen 6, pericardium 6, stomach 36, liver 3, and LI 4. It's pretty remarkable slide. Another way that acupuncture works is the Somato autonomic reflex. I don't want to get into this too much, but just because Deepak talked about it earlier today, the chronic fight or flight mode that we're all, the chronic sympathetic overdrive that we're all involved in at all times, can be modulated using acupuncture. And this is very easy to study using animal models. They can actually clip the vagus nerve of a dog. I'm sorry if that offends anybody. And then use acupuncture of this stomach 36 point and find that it restores all sorts of intestinal problems using the bottom end of the vagus nerve. So it increases the parasympathetic rest and digest mode. It does so by activating the thalamus and the hypothalamus, as shown here. And so in a cardiology or in a medical context, we don't have any drug that can help to restore the parasympathetic tone. In fact, most of our cardiology drugs are based at blocking the sympathetic overdrive, beta blockers, ACE inhibitors, clonidine, these other drugs, even some of these really invasive procedures that are really top of the line right now, stellate ganglionectomy, renal denervation. These are all things that can be replaced with acupuncture or implanted acupuncture. And actually, there's quite a bit of research right now in trying to stimulate the vagus nerve, as though acupuncture doesn't exist, which is a little bit frustrating. But what's nice is that they end up doing all of these studies that show how important it is to stimulate the vagus nerve. Pranayama, breathing, yoga, meditation, all of these things can also stimulate the vagus nerve. The only reason why I perseverate about acupuncture is because it is something that can be done to you, just to give you a sense of how that works so that you can then take it forward from there. But it's certain, these drug companies, or these device manufacturers, are showing that stimulating the vagus nerve can prevent heart failure, can treat chronic pain, migraines, obesity, stroke, traumatic brain injury, rheumatoid arthritis, and even diabetes, which is remarkable. So we'll use that data to support the use of acupuncture. That's not even to talk about how we think acupuncture works. Now, acupuncturists will talk about use of meridians. It's worth talking about what these are, because these are really complicated, complex. They're mysterious. It's strange because these meridians don't exist as a dissectable thing. It's not an artery or vein or nerve. But if you inject an acupuncture point with a tracer, a radioactive tracer, you can watch the tracer go up through the meridians. And in order for it to, and the you know, as much as we've kind of gone through the history of modern hip ways of understanding the human body, the most modern, most hip way of understanding the human body is the fascia. And this has led, unfortunately, about 5 years ago, the lay press touted this undiscovered new organ system, as though nobody had ever really heard about it. But fascia has always been known about it. It's just that I learned about it as the thing that you cut through to get to the target organ. And that's because most of what I learned came from dead people, pathology or slides that are removed from biopsies. It really took the Eastern traditions and physical therapy to understand alive things like fascia. And fascia is very mobile, and it really doesn't have the same effect in dead people. But it does conduct a huge amount of information. So it's a liquid crystal, meaning that when it's tight, it conducts electricity. When it's loose, it doesn't. When it's tight, it also conducts mechanical information. So if you're about to roll your ankle, you have a tight pull of fascia that goes all the way up and intercepts along your nerves. And your nerves are also lined in myelin, which is a form of fascia, and basically can help with the transmission of information. Fascia is organized into connective tissue planes. Now, I never learned about this in medical school, but this is well understood in physical medicine and also physical therapy literature, personal training. A lot of physical athletes will understand this, but acupuncture theory understands this, yoga theory understands this. These are all been mapped, and there's a very close overlap with the meridians. A lot of yoga involves specific stretches of these, what I would call meridians. So there's a lot of overlap here, and you can look at the yoga here on the left, physical medicine research on the middle, and acupuncture on the right. We're all describing the same things. The extended side angle pose is one of my favorite because this shows the gallbladder meridian and helps to understand why it is that we use points in the feet to treat headache, which otherwise doesn't make any sense. But what happens when you put acupuncture needles into tight fascia is that the needle manipulation causes the deformation of connective tissue. And in response to that, the fibroblasts change. The fibroblasts are the cells that secrete more fascia. They change their shape to add slack. So if you have a tight rope, they basically add slack to that rope. They expand within a few minutes to remodel their cytoskeleton, and then they start secreting more collagen to make more fascia. And so this is this is how we understand distal points. Another interesting thing, I won't talk at all about trigger point injections, except to know that I just want to share that trigger points are something that's well understood in Western medicine, used to be commonly used, but basically the injection of saline into acupuncture points, what we call trigger points, has a huge overlap with acupuncture points. And if you map out the referral patterns of trigger points, you recreate a lot of what's done with acupuncture. So this is kind of fascinating that the trigger points can have a pretty dramatic effect that's somewhat similar to acupuncture. So I say this because this is all, it's complicated. It's complicated to use complicated systems thinking. And this is what happens when we try to use this mechanistic 20th century understanding of how machines work to understand how acupuncture works, because you end up completely flabbergasted about all of the ways that acupuncture works, and you end up not knowing how to use it, if it's real. So what's easier to think about all of these things? Gate control theory, endogenous endorphin release, inflammatory signals, limbic system deactivation, that's what's happening inside the brain, autonomic modulation, fascial manipulation, or let's just pretend and create a construct, call it chi, and say that acupuncture relieves stagnation and restores the normal flow of chi. And this can happen systemically. So if you have a local pain, it restores the flow of chi there, restores stagnation, or systemically, if you are generally very tense and frustrated, it can just restore things systemically, and that's for whole body diseases. To me, you don't have to go off of any deep end in terms of understanding. You're welcome to, of course, get very esoteric about the origin of qi, how to use this, how to manipulate this internally, what exercises, qi gong, breathing, pranayama, yoga, all of these things, spiritual work. But for the purposes of using this, it's just helpful to understand. It's like the idea of entropy. It's just easier to use it. So let's go over some of the evidence base for this, because, and I want to be careful here on time, but how effective is acupuncture at relieving the manifestations of stagnation? How effective is it at treating all of these diseases? And it's an important thing to rush through, and I apologize, this is going to be relatively rushed because I do want to leave time for questions, but let's run through all of the data for all of these things on the left. So a Cochrane review for so Cochrane meta-analysis is the top line evidence base that doctors go to, scientists go to it compiles all of the studies that have been present, and they basically do a very, very, very in-depth literature review to try to understand if something is true or not. Cochrane meta-analysis said that there's low to moderate level evidence, there's low to moderate level evidence that compared with no treatment or standard therapy, acupuncture improves pain and stiffness in people with fibromyalgia. There's moderate level evidence that the effect of acupuncture is no different than sham acupuncture in reducing pain or fatigue or improving sleep or global well-being. So what does this mean? This means that compared to nothing, acupuncture is helpful. Compared to sham acupuncture, it's not helpful. So one last thing we have to discuss, the elephant in the room. Is acupuncture a placebo effect? Let's start off by saying there's an efficacy paradox. This is called an efficacy paradox. If you look at how effective, say, migraines, acupuncture is compared to medications for migraines, you see that medications, just look at what's called the response rate, how many people responded to the treatment. You can see here on the right, acupuncture is more effective than medication. What if you look at the treatment versus placebo? And this is how most studies are reported. You see that medication is more effective than acupuncture. What's happening here? What you see, what's happening is that medication, placebo medication, meaning a sugar pill, is about 22% effective. And this is about across the board, 20 to 30% effective. And placebo acupuncture, meaning a sham acupuncture where you lie down for 20 minutes and get fake needles or real needles in the wrong places, is about 40% effective. And this is also about, across the board. And this is actually, going on to surgery. Apparently surgery is more like 50 to 70% effective if you look at placebo surgeries. But for the purposes of research, we always compare real against placebo. And if that's what you're looking at, then you're going to be, you're going to see that acupuncture is less, it's going to look like acupuncture is less effective than medication. It's also going to look like you have to have a lot more patients to be able to see the difference between real acupuncture and fake acupuncture. And this is outside of the finances of most acupuncture research. When you have very, very, very large studies, so another Cochrane meta-analysis of 5,000 patients looking at acupuncture for nausea, they did see that there was an effect of acupuncture compared with sham acupuncture, but you don't really see this for other things. So we'll talk about this, and knowing that, we'll be able to look through this. So acupuncture for migraine, for example, available studies suggest that acupuncture is at least as effective or possibly more effective than prophylactic drug treatment of migraines and has fewer side effects. Sounds great. Here's what's called a forest plot. So I don't want to go into the specifics, but generally these boxes here are the effect size. And you can see if you put them all together on the left, if you're kind of favored to the left, that means it favors acupuncture. Favored to the right, it favors control. And you'll see here, this is acupuncture versus something. It's generally pretty effective. Acupuncture versus sham, it's kind of midway. You're not so sure. Functional GI disorders need to be split up. Gastroparesis, here's a forest plot. Acupuncture versus other drugs, domepridone, cisapride, mosapride, versus sham acupuncture, quite effective. Functional dyspepsia. For another Cochrane review showing 4 randomized controlled trials show no difference between acupuncture and medications, which is phenomenal. We'll just skip through some of these things. Irritable bowel syndrome. This is really fascinating. So if you look at irritable bowel syndrome, acupuncture versus the other things, acupuncture versus drugs, and apologize, this is flipped now. So pro-acupuncture effect is on the right, anti-acupuncture effect is on the left. Acupuncture versus all of these things versus psychotherapy versus probiotics versus Chinese medicine versus Chinese medicine alone. More effective than control. However, if you look at acupuncture versus sham acupuncture, you get a more mixed result. And this is worth describing a little bit better. So if you look at sham acupuncture, somebody named Ted Kapchuk, who's a professor at Harvard, the Institute of Harvard Placebo Studies, used to be an acupuncturist himself and wrote one of the best handbooks on introduction to Chinese medicine, if you're interested, called The Web That Has No Weaver. His new vocation is studying placebo effect. And basically what he looked at was irritable bowel syndrome patients, and he gave them either sham acupuncture, which was an acupuncturist saying, I'm your acupuncturist, lie down, I'm going to do some acupuncture, and then does fake acupuncture, versus somebody who spends 45 minutes with them, listens to their story, tells them this is going to be great for you. I really feel for your symptoms, listens to their, looks at their tongue, feels their pulse, and then gives them fake acupuncture. You can see that is called the augmented sham acupuncture. You can see how much more effective that is than just sham acupuncture. What this means is that it's not deception necessarily, it's the doctor-patient interaction. That's the effect here. And that people blur the doctor-patient interaction with acupuncture just because in this country, for some reason, when you go to an acupuncturist, you tend to get more of that than when you go to a busy doctor. And this is not true in China, where they're quite busy. It's kind of a construct for the States. So the EastWest approach is basically, we start off with a consultation where we take a long list of medical diseases and we reduce them to 1 or 2 major processes that's related to circumstances within their control. So instead of that long list of things, we try to bring it down to one thing, stagnation, as an example. We then offer some treatment with the specific intent to just show people that they are capable of feeling better. And we would measure success by empowering them and coaching them on how to persist through these lifestyle modifications. So it goes back to meditation exercises, equanimity, all of these things. I don't know if you guys ever go far west, but we're the 4 different clinics around town: Westlake Village, Santa Monica, Torrance. Last year, or 2 years ago now, Dr. Annie Zhang and I started an inpatient consultative service. So we're now doing this to hospitalized patients that have no experience with acupuncture and really have no intention of going to integrative medicine. But it could be extremely helpful for people that are quite, really suffering quite a bit. And actually, as part of, UCLA has started this extensivist program, which is effectively kind of like a free concierge service for just the highest utilizers of healthcare, which means basically people that are not getting better despite the best efforts that we have, generally because they can't afford it. And so we're part of what they do now, which is really exciting. So I'll leave you with this, that looking forward, it's likely that the 20th century mechanistic understanding of the body is about to get much, much, much more complicated. Now, we're with proteomics, metabolomics, genomics, microbiomomics, this is about to get much, much, much beyond the realm of anything any human could actually understand. So doctors of the 21st century are going to have to rely increasingly on AI and machine learning, computer algorithms to understand and utilize all this information that we've otherwise been able to do in very basic diagrams of the 20th century. And this is probably going to succeed, hopefully, in treating a lot of major diseases very successfully. This also means that all the complex diseases will be saved for us humans. And us humans, fortunately, are better suited to understand the complex systems on a macroscopic level. The irony is that modern medicine might not be the best operating system for this task. Ancient tools such as Chinese medicine and its metaphors can allow us to utilize abstract thinking that is unique to the human brain, and computers are fortunately quite bad at it, at least so far. The other thing that humans are really good at is that doctor-patient interaction that we talked about with the irritable bowel syndrome. We would otherwise, lump into the placebo effect, which I wouldn't use the term. So ancient systems, in particular Chinese medicine, is what I'm focusing on, but Ayurveda is another one of these. That they tie together right brain complex systems level thinking with the augmented doctor-patient interaction that mixes it with acupuncture. I've shown you how these all these tools are helpful for the complex problems that don't respond to our magic bullets. And for job security, none of these are going to be replaced by robots anytime soon. So in this way, ancient systems of medicine are based in the past, but really optimally suited to tackle the problems of the future. Thanks a lot for your time and attention here. I see one question here, and I'm happy to take questions for the next 10 minutes. I have a question here about integrative medicine fellowship for physicians. So I did a 2-year integrative medicine fellowship at the EastWest Medicine at UCLA. So it's for, I'm an internist, so it was after my internal medicine fellowship residency. It's also open to family practice doctors. If you reach out to me, I can give you recruitment information, but if you can Google EastWest Medicine Fellowship, you should be able to find out how to apply and how to look into that. There's some changes presently, so I think I'd refer any questions to Dr. Katie who's in charge of that program. I see another question here. As a physician acupuncturist, how have you found the reception of acupuncture as an early low-risk intervention for multi-symptom complex syndromes? What can be done to help patients access acupuncture through physician recommendations for treatment of these complex illnesses? And how valuable are LACs in this endeavor? So so the reception is I work primarily in Santa Monica Hospital. Despite the perception, a lot of my patients do not know about acupuncture, are relatively naive to integrative medicine. Certainly in Santa Monica Hospital too, we have a lot of people coming from very far away. And the reception, I could say something about in the hospital was what, in our clinics, we tend to get people that are already self-selected towards wanting to explore integrative medicine, or maybe they've been referred to us from somebody, but they're already kind of bought in a little bit. In the hospital, I've had this experience of being able to see how people that are completely naive and actually over deniers respond to this. And generally, if there's one of the frustrations that we've learned, certainly if you've been following politics over the last several years, is that you cannot change somebody's deeply held opinion by giving them more information. So all of this data that I presented to you is not going to change anybody's deeply held beliefs. What does change their beliefs is experience. And in the hospital, the reason why actually I chose to go to the hospital is because we can change people's experience. And people, surgeons are a great example, generally scoff at acupuncture and they don't really have any interest in learning more about it, but they are very frustrated with patients that have functional pain syndromes. And when they see that acupuncture can help in that, suddenly they don't care about their prior biases. They're very excited about how they can refer to acupuncture because, generally they know that they don't have the tools for this. So the same thing's true with patients in general. Again, I'm seeing people in the hospital that are kind of desperate and they don't really care what modalities. I mean, if you try to tell them that that they need a really, really disastrous surgery, they will go for it. And I come in and I say they need acupuncture, and they're just as terrified of it, but it's not. The level is a little bit different. So in terms of using it, for your question is about how the use of the reception of acupuncture as an early low risk intervention for diseases. It's much harder as an early low risk intervention because people don't really have problems in the same way. They're not as motivated to see something. It's kind of like a spa treatment where it's a nice thing. They might feel a little nice and then they kind of go back to their old routine and nothing major changes. But if they're in the hospital because they're having ventricular tachycardia and they're dying, I mean, they're in the intensive care unit because their heart doesn't stop going up 150 beats per minute and they're in sympathetic overload, then a spot treatment is extremely medical and extremely important to what they need at that moment. And we don't have any medication that's better than that. So it's much easier to demonstrate value when they're quite sick. Thank you very much. I'm available, I think, I'm still figuring out Brella, but feel free to send me any messages through it. I'm also reachable at ashubov@mednet.ucla.edu, if you can remember that. ashubov@mednet, mednet.ucla.edu. Thanks very much.